Hey Matt, thanks so much for joining me on Journal Club. You've got a really interesting study that you actually published and did yourself on Niggles. Tell us about it.
Thanks, Randall, for the invitation. So this study was wouldn't necessarily call it an accidental study, but it was born from the Oslo Sports Trauma Research Questionnaire on Health Problems, which was developed by the Norwegian Olympic Committee with Ben Claassen. And what we normally do when we traditionally record injuries in any sport is we often just record the ones that would result in what we call a time loss, where someone misses a training session or a game. But what this questionnaire allowed us to do was to look at recording any physical complaint that an athlete or a player may have. So anything like a tight hamstring, a sore toe that meant that you could still play, but it existed. This questionnaire had really nice evidence around that. It was quite useful. So what we did, we actually ran 2 injury surveillance programs in one with 218 players over a 35-week season in semi-professional football, soccer. And they completed this survey every week, the day after a game and before the first training session, so a Monday or a Tuesday. And they completed for the whole season. The questionnaire, if there's no injuries, takes about 3 to 4 minutes. And over that time period, the players and the clubs were blinded to the results of that. But at the same time, we actually recorded injuries as you normally would do in terms of as a third party or a physio or sports trainer would record injuries at the same time. Then what we did over the season was we sort of looked at the presence of a minor injury, so something which would not stop someone from playing or participating, which we often will call in Australia a niggle or a non-time loss injury. And if that was reported, what was the risk of a player developing a more severe injury in the next 7 days? So developing into a time loss injury. So we picked 7 days because a lot can happen in 7 days in general, but also then if you go into 14 days, there's another game in between that. So we came to the 7-day period. And what we found is that if someone had a minor issue that affected their performance, their ability to participate, their training volume, or the severity of the pain was minor, the risk of developing a time loss injury in the next 7 days was around 3.5 times greater than normal. And if they had something which was a bit more significant, so a moderate reduction of participation, then they actually went up to almost 7 times greater risk of missing a training session or a match in the following 7 days.
So Matt, was that like just essentially like a tight hamstring or a tight calf, or was it actually a bit more than that?
No, it could have been anything that the athlete perceived. So part of this is around that one of the limitations in the time loss definition of injuries is that it requires an athlete or a player to report it to a medical person or a coach that they have a problem. And anyone who's worked in sporting teams knows that often players don't like to report those things. But this actually survey gave it was actually just done by the player themselves. So it was their perceived issue. So they might have had a tight hamstring, which they thought affected them mildly, whereas another person might say that it affects them moderately. But it could have just been any physical. The definition we asked for was any physical complaint. So any tightness, pain, anything which was different from their normal, we wanted them to report.
And it's quite significant that it was actually somewhere roughly between a 3 and 6 times more likelihood of sustaining an injury after these niggles. So in answer to your question, I think your paper said something along, do niggles actually matter? The short answer is yes, they do. Is that a reasonable, quick executive?
Yeah, I would probably put an asterisk on it. I think they definitely do. And I think it comes down to almost the culture of why we record injuries. And often it's hard to encourage people to record injuries because what do we do with that injury data? But in some ways, what I really liked with what we found was that it gave us a little bit of more of an insight into, number one, the prevalence of these injuries. So when we looked at how many players out of the 218 that were included that were affected by a niggle every week, we're looking around 28% of our players had something going on every single week. And then up to a third of the players had something that may have kept them out. So a third of your players every week had something going on which they reported as different to normal, but may not have affected their participation in play. So as clinicians or as performance people, then there's a bit of work there that we can do potentially to reduce that if it affects performance in particular, but also from a long-term participation in sport, that's important. I would also say that the risk is important to sort of qualify in that the normal risk of someone obtaining an injury in 7 days was 10%. So if players reported they had no problems, the chances of them missing a training session in the next 7 days was 10%. So the increase in risk is going from 10% to 30%. And while 3 times is not insignificant, it also tells us that there's a 70% chance nothing will happen to them. So I think when we start to talk about risk is a really good way to present things, and especially talking to coaches and to players. But I think also presenting both sides of it's important to go 3 times higher it sounds dramatic, but 30% risk when 70% chance nothing will happen is also a nice way to ground and anchor our conversation. And finally, the other part, there was a lot of what we call false positives, where you'd have a player that would report a niggle, but then nothing would happen in the next 7 days. So we definitely want to use this concept to go, you will definitely get injured if you report a tight hamstring in the next 7 days. What we want to do is it adds to our knowledge base and may help protect and help identify players at increased risk.
One of the things I wondered when I read through the paper was whether a hamstring tightness or pain, for instance, actually resulted in a hamstring injury, and a knee kind of niggle resulted in a knee injury, or an ankle kind of grumbling along actually then went to become an ankle injury. Is that something that was borne out with the data?
Yeah, it was actually quite interesting when we started to dive a bit further into it, because we did have when the players reported a niggle, then they were asked questions about where the locations were. Now, one of the limitations of the study was by delivering something weekly, then players can have more than one thing in 1 week, so they could report a knee and a hamstring in the one form. But what we found was that players, like with a hamstring and a knee, 90% of hamstring injuries, 90 to 94% of hamstring injuries were preceded by a report of a niggle in the hamstring area. And also the same thing with the knee, about 90% of knee injuries were, like if you reported a niggle in the knee, there's a very, very good chance in 90% of cases that they missed a training session in the next week to week and a bit. So I think part of that comes down to, well, if you're reporting it as the self-report, you've reported it to the medical people as well, because we didn't control for that. But like you can, and the ankles were very similar, where those players, if you report an ankle, there's a fair chance you're going to miss a session in the next week. On the flip side of that, things like a hip and groin and a lower back, we found there was quite a high ratio of niggles. So there's a lot of niggle reporting for lower back and hip and groin injuries, but it appeared that a lot of players were able to continue to play despite the presence of pain there. So again, when we're starting to target injury prevention practices or risk mitigation, then it does again start to add into the picture of, well, what are we trying to prevent? If someone reports something, does that flag, and how not conservative, but how much do we act on certain reports from players?
I mean, is that something? I mean, you work in elite sport, and you know what it's like with coaches and players at times is they hate missing training. They don't want to be not part of the group. And if they report a niggle, sometimes they just want to flag it, but they don't want anything to change. Whereas with your research, essentially it's like some intervention kind of needs to be kind of made, if we're going to try and decrease the actual serious injuries from these niggles. Do you think that that your research could worry athletes and also coaches, where they would actually not want to report as much? It's like, I know that if I get a niggle, if I report it, they're going to pull me back and I might get injured, where they'll just say, I'm not going to tell anyone about it, and create almost a culture of secrecy.
And I think that's this is the challenge of language, I guess, in our profession, and especially from a research perspective, is we put the information out there, but sometimes we struggle to provide context. So, like, I've used most of the findings out of this study were not necessarily surprising, but it was actually quite, it's been interesting to see how we've put them into place in different systems that we've worked in. And I've probably used it much more now to give confidence, to allow players to explore playing with backgrounds, soreness, tightness, the niggle kind of concept. So, for example, we've had players we've got more confidence with groin injuries or hip-related groin pain in particular, where we know that players can probably keep playing as long as it doesn't impact on their performance. And also we found that if players it was pretty consistent, whether a player in the questionnaire that you use, there's 4 components around performance, participation, volume, and pain severity. If you use any one of those same questions, that it all gave the similar type of risk identification capacity. So we often will now say, look, can you train today? And they say yes. Will it affect? Do you think you can perform well? And they might go no. And then that from our end, we might use that bit more of a flag to go, maybe we need to do something here. But if they don't think that the niggle will affect their performance and they think they can play, and we've done our thorough assessment, then we may actually have more confidence now to go, well, maybe we'll roll this out. That's, of course, with lots of other factors around knowing who the player is and what their underlying issues are. So I think the concept of risk is a really good thing to understand here. So around 3 times, like the words I said before, there's what's the risk of something happening versus the risk of nothing happening. And that's why I'll always in these sort of around the basis of these studies say, look, this is identifying players potentially at increased risk, not ones that we can predict will have an injury. And there's no predictive value in a niggle beyond saying, look, there's a chance that this is more of a secondary prevention tool to go. It's just thinning the herd to identify ones that we can be a bit worried about.
So we're fortunate that, you work with elite soccer or football, and there's a team around these athletes who can help make these decisions. But you're also a clinician in your practice as well. And if you're advising your own athletes who may only come and see you a few times a year about whether niggles matter and what to do about it, what's your blanket advice for people if they start to feel a bit sore, they start to feel a little bit tight? What should they do?
Yeah, I think one of the follow-up studies that should come from this sort of work is, okay, what do we do about the niggle? So I think one of the big questions I have after these studies say, if we reduce the niggle, so if a player turns up to my clinic or into a team environment and they report a tight hamstring, and then we do something, whether it's a manual therapy or whether it's an exercise-based therapy, that removes that niggle. So after the session, they no longer have the presence of a niggle. Does their risk reduce? Clinically, and probably a lot of clinicians will have that view where you can do things and it makes people feel better, and then they get through the session. So I think from my end, the key is that we want people to report the niggle because then we can assess it and do something about it. I think as clinicians, then it's up to us to build that trust with the athlete or the patient to then not look at a niggle as you're guaranteed to get injured, but also then present the risk case to the athlete. But what we want to try and do is go early intervention of once a niggle comes on, let's intervene because we know that we can be pretty confident that if you let it keep going, this is going to happen. Again, then you start to look at the mechanisms, whether it was a contact injury or non-contact injury, but the culture of reporting and then us having maturity as clinicians, potentially hopefully informed by research such as this. And I know there's more research coming out that is supporting of this type of linkage between niggles and time loss injuries, that we have a consultative approach that we can then inform the patient of risk better than we probably have done in the past, where rather than you either participate or you don't participate, then we can start to inform and go, look, this is potentially the risk that you're taking. And then and the coach can be involved in that too, like that shared care model. And then you're starting to go, look, because the pain is significant, there's a 50% chance that you might end up with a time loss injury. But there's a 50% chance nothing happens. Or if it's a minor thing, there's a 70% chance. And we can anchor ourselves in a bit of science around that, but also understanding that everybody's different. The game is chaotic in terms of we can't predict what's going to happen, but we can start to contribute to an informed decision process.
Well, I'd like to congratulate you on what was a very thought-provoking piece of research. I think that as a physio, these are things that we've tossed around all the time for generations, really, whether these niggles do turn into real injuries. You've got some data behind it. It's been very helpful, particularly with athletes in elite sport. So, Matt, thanks very much for joining us on the Journal Club this week.
Thank you very much for having me.